And just to give people an idea for the order of magnitude, right? I'll have to explain a bit more about healthcare prices. Um, and this is something that just is mind-boggling when you look into it. Um, in most in most healthcare markets in the country, prices vary widely. I'm not talking about, one gas station, it's $2 and the next station is $2.10, right? The equivalent would be a gallon of gas is $2 at one gas station, and then across town it's $5.
Yeah, we've done research that shows that the price differentiation for exactly the same service can be over 1,000% different.
Yeah, yeah, that's exactly right. And it is not just across hospitals, it is also within a hospital, right? So the negotiated rate that an Aetna has could be 2 times higher than the negotiated rate that a different insurance carrier has. So it's a very odd market. And Todd, generally, um, if a market were efficient, you wouldn't be seeing price differences that are this big, right? You would expect prices to be a bit more in a narrow band. But it's not the case in healthcare. And so that, of course, immediately opens up the opportunity to say, well, why don't you then, send people to those healthcare providers where the cost is low? Um, and of course, the objection to that is usually, well, I mean, if it's a low cost, I mean, who knows if they're any good, right? I don't want to send somebody to a doctor that isn't very good at doing the work that they do. Well, the other weird thing about healthcare is that that's not the case. The low cost does not mean low quality, and conversely, high cost or high price doesn't mean high quality either. The two are
Yeah.
completely disconnected from one another. So you can, in most healthcare markets, you can find providers that are not only low cost, but also high quality at the same time.
So there's a running joke in the healthcare industry. What do you call the guy who graduated from medical school at the bottom of his class? Doctor, right?
Indeed, indeed.
So, I want to make sure we don't go past some of these very complicated concepts too quickly. When you correctly pointed out that the insurance companies have become more service companies rather than insurance companies, meaning they're no longer spending the time to underwrite the risk in the way that they used to. And the company is taking the first risk position. So that means that the insurance company actually is ambivalent to cost, right?
That is
Because they're just
very
paying the
true.
bills. Whatever the bill is that's what they're paying. Now, the other thing that's important here is now the employer is paying the bills, but there's such an asymmetry in knowledge, meaning an imbalance of knowledge around what prices really ought to be. The person who's the head of HR doesn't really need to know how to go into that. And so there's a desperate need for somebody to come in like Karam Health to say, hey, we know a little bit about costs. We know about this supply chain in specifically. We Kara may not know a whole lot about how a motherboard's created for a computer, but we know a lot about how healthcare works. So we can be your supply chain manager, your cost containment partner for these kinds of procedures, and provide to you a simplified pricing mechanism in the form of a bundle that includes everything in the element. I wrote in my book the example. I was kind of chastised a little bit that it was very a male example, but I said, today, most of us don't know how to change the oil in our car.
Mhm.
So we take it to the dealership and we compare price there versus the Jiffy Lube across the street. And we make a risk-based analysis as to whether or not we want to take it to the dealership versus the Jiffy Lube. But we never question whether or not we're going to get a subsequent bill from the oil delivery company, and then another one from the oil installation guy, and another one from the oil disposal guy, in addition to the charge from the dealership. What you've done, as I understand it, is you've created a bundle that says it's all one price. We're going to take all these, the anesthesia fee, the surgical fee, the physician fee, and the facility fee, and we're going to put that all into one price, and that's what we're going to charge you. And by the way, because these things are all aggregated, we're going to be able to charge you less for the procedure than otherwise. Is that fair to say?
Absolutely fair to say, Todd. And you point out a really another challenge in healthcare, right? In addition to prices varying wildly prices and quality not being correlated to one another. The third problem is that the way we pay for healthcare is part by part, right? That's what people call the fee for service model. And that is a lot of incentive problems, right? If you're paying, we just had some work done on the house. And with the contractors, we negotiated a fixed price. Because if you're paying a contractor time and material, what incentive do they have to complete the work quickly? They don't, right? It's much better for them to take their time and just charge you more for the time that they take. And that is unfortunately how healthcare works. And so you're exactly right. This idea of bundling is another core element to our value proposition, which is we take all the pieces and put them together and ask the provider to give us a fixed price for all the things they need to do. And what that does, it now creates an incentive for the provider, the same way it does for my home contractor, to be more efficient, to try to get it done more quickly, to really look at the cost and think about, isn't there a better way of doing this? Do I really need to keep the patient in this expensive room, or do I really need to do this expensive test? Does it actually make a difference for the outcome for the patient? So that's another really important concept. The other important concept in those bundles is also they come with a warranty, Todd, and that's actually really important because, if you're, let's take the home contractor example, right? If I just make a fixed price contract with them, they have incentives to cut corners, right? Maybe they'll use shabbier wood. They only use half the number of nails that they should be using in the framing. And then, of course, the house might collapse. And that's why in those instances, it always comes with a warranty on good workmanship, right? If the house collapses, the contractor's on the hook to fix it. And that's what we bring to our bundles as well. So the providers take accountability for the full cost of the episode, and they have an incentive to find efficiencies and deliver the same service better. But there's also a warranty. So the provider on our model is on the hook if complications arise. So provider is disincentivized from cutting costs in a way that cuts corners. And so the result is that there's this laser focus on the cost of care delivery, really for the first time with the provider, and there's the warranty to make sure that they also get the level of outcomes that we want.